Today, I'm thrilled to announce my plan to lower healthcare prices for all Americans and truly make healthcare affordable again. We're doing things that nobody's ever been able to do. We're calling it the Great Healthcare Plan.
I'm Dr. Ida Brown.
And I'm Dr. Sonia Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. And so it begins. Trump has created his own healthcare plan, you guys. This week, the White House introduced what they're calling the Great Healthcare Plan. The stated goal, of course, is very straightforward. It's supposed to lower healthcare costs for all Americans. And immediately, the reaction split down familiar lines, as you guys already know. Supporters say it will finally take on these companies and the insurers. But then the critics are saying it's going to weaken the protections built in that were already there for Affordable Care Act, better known as what? Obamacare. So let's break this down today and look at actually what's being proposed, what it does, what it doesn't do, and how they compare. Because the truth is, Americans deserve healthcare. We all know that. But neither of the plans are perfect. And both, though, do really adjust and try to respond to a real problem in the United States, the affordable care that we don't get. So they just started this very, different assumptions of how healthcare should work. I mean, if we look at one plan, we have to compare to the other. And so this new plan is not just centered on expanding coverage, which what Affordable Care Act was. It's more centered around cost control, which is important. It assumes that many Americans already have insurance, though. Not all Americans have insurance. That's a fundamental flaw, Dr. Brown. So these insurances are already too expensive, too disconnected to what real price pressures are for most Americans.
Dr. Sloan, you are right. So let's take a look at the philosophy that drives these four main components of Donald Trump's great healthcare plan. Let's roll the clip.
It'll bring down drug prices 80, 90%, in some cases, just numbers that nobody's ever heard of before. Your prescription drugs will come way, way down. And under this policy, the prices of many drugs will be slashed by 300, 400, and even 500% starting this month at the TrumpRx.gov.
So,
did he just say TrumpRx.gov?
Yeah, so let's get into it, right? The first pillar of Trump's great healthcare plan focuses on one of the most frustrating parts of the healthcare system here in the United States, right? The prescription drug prices. The argument is simple. Americans routinely pay 2 to 3 times more for the exact same medications that patients in other developed countries pay. And so this plan proposes tying U.S. drug prices to what those countries pay. And that's essentially saying that Americans should not be subsidizing the rest of the world in terms of our expenditures on these plans, on these prescription drugs. But for those who've had to choose between rent and refilling a prescription, that message really lands, right? The plan also expands access to certain medications over the counter. So when you are thinking about something like a simple cold, this is going to actually reduce the need for doctor's visits just to obtain any basic treatment. So that could mean fewer unnecessary appointments, lower out-of-pocket costs, and faster access